Hey, what's going on, YouTube? Honest Abe checking in today. I just wanted to give a quick shout out to my son JoJo. He's doing well. He's finally back at home. He's resting today. There was some confusion last night on trying to get him out of the hospital, but he did finally make it home last night. And what I wanted to do is I just wanted to talk about appendicitis today. And by no means I am not a medical expert. But this is just information that I learned over the past several days related to um, Joe's surgery and everything that went along with it. But again, shout out to everybody at Children's Hospital, all the doctors and nurses and everything for taking care of Joe. We greatly appreciate it, and he is fully on the mend, and we'll get to go back to school on Tuesday. So very happy about that, and definitely wish him the best in his recovery. As he moves forward in the next couple days. But appendicitis, basically, it's an infection in your appendix, and your appendix is attached to your intestines, and basically, I guess it acts like a filter um, when you need to go to the bathroom. Specifically, you need to go number two, so to speak. And basically, what happens is sometimes your appendix can get blocked, and that blockage can cause an infection. And so this is what causes appendicitis. And it can be very dangerous if your appendix ruptures because that infection can spread into your intestinal tract and some of your other organs around there by your colon. And it can cause sepsis and some other complications. But basically, what happened with Joe is his appendix ruptured, and so it ruptured. I think it was Friday, maybe even Thursday night, and he was in a lot of pain. Friday, couldn't move, and so took him to the doctor, and then we ended up in the emergency room where they said he basically has appendicitis, and went through X-rays, blood tests, urine tests, CT scans, ultrasounds. Basically, the whole 9 yards was done to see if his appendix had actually ruptured. And apparently, this is very common in kids his age, roughly from about the ages like 9 to about 12 or so. It's actually very common for appendicitis to occur in kids, and even for it to rupture. And so what happened is his actually did rupture, but they couldn't see his appendix in any of the ultrasounds or scans or anything because there was so much fluid in his stomach. And so the doctors suggested, the surgeon said, we need to go in and do surgery. And we're gonna remove the appendix, and we're gonna actually see if it had ruptured because they couldn't tell on any of the CT scans or anything if it had or not. And they said this is very common. But he was kind of scared going into surgery a little bit. Obviously, it is a major surgery. I mean, no surgery is minor. But I was there to help comfort him during that time, and I told him he was going to be okay. And it was really cool to see the doctors and stuff just to kind of support him and continue to tell him that things were going to be okay. So I mean, again, thank you guys at Children's for everything you guys did to help out with the surgery. But the surgeon talked to us right before the surgery. He said, he's going to go in, and surgery is going to take about 30 minutes or so. Of course, he would probably be under anesthesia for a little over an hour or so. A little prep on the front, and then post-op stuff. But he went in early Saturday morning for surgery, and by the time I sent him off to the surgery room with the doctor, and then the surgeon came in to give me the update, it was maybe an hour and a half total that the surgery took place, and I was back at his side. So surgery doesn't take very long for appendicitis, and if it's treated, and even if there is surgery needed to remove the appendix, which apparently you don't need, you can recover fairly quickly, and in kids they recover quite quickly. But he was definitely trying to run around and get back into the swing of things. He definitely wanted to get out of the hospital. So just very happy that things went well. And I can't say enough about the people at Children's Hospital and everything that they did to take care of JoJo. So I appreciate that. But hey, open up a conversation here about this. If you've had your appendix removed, or maybe even any other surgeries, I myself have never had to go through any type of major surgery besides getting my wisdom teeth removed. So it's something that I've never actually experienced myself. But continue to watch the videos, like and subscribe. I'll probably end up putting a couple more out before the weekend. And I appreciate it, guys. Hope you have a great evening.